I'm Dr. Nathan Wells. I'm a board-certified internal medicine physician, and I've spent over 20 years working specifically with patients over 60. I've watched the research on brain aging shift dramatically in the last decade, and what I'm about to share with you today is something most people over 70 have never been told. Not because their doctors are hiding it, but because it doesn't come up in a 12-minute appointment, and it doesn't come in a prescription bottle. A 2020 study published in the journal Neuropsychology, following adults over 65 across multiple clinical sites, found that one specific daily habit produced measurably greater improvements in memory and executive function than either physical exercise or mental exercises done separately. The combination outperformed both by a margin researchers described as clinically meaningful. 10 minutes a day, no equipment, no gym, no app. And the vast majority of people over 70 are not doing it. I want to tease something for you right now, because what I'm going to tell you midway through this video is something that will probably surprise you, and it directly contradicts the most common thing my patients tell me they're already doing for their brain health. Most of them think it's working. The research says otherwise, so stay with me, because the order of what I share today matters. Before we go further, if you have a spouse, a sibling, or a friend over 65 who has been quietly worried about their memory, I'd ask you to share this video with them before it ends, not after. Because what I cover today is the kind of information that changes what someone does tomorrow morning. Now, let's talk about what's actually happening inside your brain after 70, because once you understand the mechanism, the habit I'm going to give you will make complete sense. Your brain contains roughly 86 billion neurons. By your 70s, the speed at which electrical signals travel along the white matter highways connecting different regions has slowed measurably compared to your 40s. Think of it like an old copper phone line versus a fiber optic cable. The message still gets through, but it takes longer, and when too many signals compete, some get dropped. That slowing is normal. What is not fixed is how steep the slope is. A landmark 2014 study in JAMA Internal Medicine found that slope is significantly shaped by something called cognitive reserve, essentially the mental redundancy your brain builds over time. When one pathway slows, does your brain have another route? That reserve is not set at birth. You can still build it at 71, and you can quietly squander it without realizing it. That last point is exactly what was happening with my patient Margaret. She's 74, came to me about 2 years ago, told me she kept losing her train of thought mid-sentence. "Is that just getting old?" she asked, "or should I be worried?" The honest answer, the question matters less than what she does next. She was already doing what most people her age do when they notice memory slipping, and it wasn't working. She did crossword puzzles every morning. Crossword puzzles are not the habit. I want to address this head-on because crosswords are the most common thing patients tell me they're already doing for brain health, and they're not wrong to do them. But they're also not getting the specific benefit they think they are. A crossword puzzle challenges retrieval memory. You're reaching into long-term storage to pull out a word you already know. That's not nothing, but it's a fundamentally passive exercise. Your brain is retrieving, not building. It's like going to the gym and only doing the same 10-pound dumbbell curl you've done for 20 years. You'll maintain what's there. You won't grow new pathways. The NIH-funded ACTIVE trial, one of the longest cognitive intervention studies ever conducted, following over 2,800 older adults, found that training and processing speed and reasoning produced measurable cognitive benefits that lasted up to 10 years. Crosswords were not one of the tested interventions, and the researchers were specific about why. Novelty and challenge are the active ingredients, not familiarity and retrieval. What actually works is making your brain do two things at once that it finds genuinely difficult, not impossible. Difficult. Let me introduce you to Frank. He's 78, a retired electrician, sharp as a tack in conversation but starting to notice what he called brain fog on the golf course, miscounting strokes, losing track of whose turn it was, blanking on names of guys he'd played with for 15 years. Frank came to me after his annual physical, and I asked him one question. "How often do you do something that makes you feel mentally clumsy?" He laughed. "Not since I retired," he said. That was the answer. When you stop doing things that feel awkward and hard, your brain interprets that as permission to prune the circuitry that handles novel challenges. And it does, aggressively. Your brain is ruthlessly efficient. It will cannibalize any neural pathway it decides you're not using. So I gave Frank the same assignment I'm going to give you, and the same one I gave Margaret. Walk for 10 minutes. While you walk, count backwards from 200 by 7s. Out loud if you can, in your head if you're in public. That's it. That's the starting version of the habit. Before you roll your eyes, I know how that sounds. It sounds almost insultingly simple. But what it does to your brain is not simple at all. Walking, especially outdoors where your visual field is constantly shifting, activates the cerebellum and the vestibular system simultaneously, requiring your brain to process balance, spatial orientation, and proprioception, your sense of where your body is in space, all at once. When you layer mental arithmetic on top of that, you're forcing your prefrontal cortex and your working memory to stay active while another part of your brain handles locomotion. This is what dual task training does. It prevents your brain from assigning physical movement to autopilot, because autopilot and active cognition can't fully coexist when the cognitive task is genuinely hard enough. A 2020 study in the journal Neuropsychologia found that dual-task walking exercises, walking combined with a concurrent cognitive challenge, produced significantly greater improvements in executive function and working memory in adults over 65 compared to walking alone or cognitive exercises alone. Not slightly better, the combination outperformed either activity by itself by a margin, researchers described as clinically meaningful. Here's the analogy I use. Imagine your brain's resources as a single garden hose. Walking alone points the hose at the motor and balance centers. Sitting and doing mental arithmetic points it at the prefrontal cortex. But doing both simultaneously forces the hose to split its flow, and your brain, being adaptive, responds over weeks and months by increasing the diameter of the pipe. That increased capacity is exactly what cognitive reserve means in practice. Now, counting backwards by 7s is just one version. The rule is this: the cognitive task has to be hard enough that you can't do it effortlessly. The moment it feels easy, it stops working. Your brain adapts fast, sometimes within 2 to 3 weeks. So progression matters. Here's how to build the habit across 4 stages. Start with counting backwards from 100 by 3s. Most people can do this without too much struggle, and that's fine. The point is to establish the habit of the dual task, not to overwhelm yourself on day 1. After 2 weeks, move to 200 by 7s. After another 2 weeks, try naming a category: animals, countries, foods, 1 per step, alternating feet. So, left foot, elephant; right foot, Brazil; left foot, mango. This sounds almost playful, but the cognitive load is surprisingly high because your brain is generating words, checking for repetition, maintaining forward movement, and tracking alternation simultaneously. The final stage, which I'd aim for by month 2, is what I call the conversation layer. Walking while holding a phone conversation about something intellectually substantive, a podcast discussion, a book you're reading, an opinion you're forming. Not gossip, not logistics. Something that requires your working memory and language centers to do real work. I want to pause here and say something directly. Everything I'm sharing today is educational. It's meant to give you solid, research-backed information to bring into a conversation with your own doctor. Your doctor knows your full history, your medications, your cardiovascular health, your balance issues, if any. Some of you have conditions that might affect how you do this exercise or how you progress through it. This is not a replacement for that conversation. It's fuel for it. If you found this useful so far, I'd genuinely appreciate it if you'd share this video with someone in your life who's been worried about their memory. Not to alarm them, to give them something actionable. Now, Margaret, I want to come back to her because her story doesn't end where I left it. After about 6 weeks of doing the dual task walk every morning, she did it right after coffee, before she did anything else. She came in for a follow-up and reported something I hear often from patients who stick with this. It's like my thoughts are less sticky. That's how she put it. less sticky. What she was describing is a reduction in what neuropsychologists call perseveration, the tendency for the aging brain to get stuck on a thought, a word, or an incomplete idea and struggle to move past it. Her husband had noticed it too, before she did. I asked Margaret if she'd gotten her numbers checked. She had. Her blood pressure was down 4 points. Her resting heart rate had dropped slightly. Both of those matter for brain health, by the way. The AHA has published extensive data showing that what's good for your cardiovascular system is, with very few exceptions, good for your brain. The two are not separate systems. They share the same blood supply, and when your heart pumps more efficiently, your brain gets better oxygenated blood to the neurons that need it. Walking was doing double duty for Margaret without her realizing it. Frank's outcome was different. He stuck with the habit for about 3 weeks and then stopped. Told me he felt silly counting numbers while walking through his neighborhood. I pushed back on that a little harder than I usually do with patients. I told him that feeling silly is not a reason to stop doing something that works. He started again. By month 3, the name blanking on the golf course had decreased noticeably. His wife told me at his next appointment that he'd started talking more sharply. Her exact words. There are a few things that will kill this habit before it takes root. The first is doing it at irregular times. Your brain consolidates new behavioral patterns far more effectively when they're attached to an existing cue: coffee, breakfast, the morning walk you already take. Don't make it a standalone event that lives in your calendar. Attach it to something. The second thing that kills it is making the cognitive task too hard too fast. If you start with 200 by 7s on day 1 and you can't do it without stopping to think, you'll get frustrated and associate the exercise with failure. Start easier than you think you need to. The third thing, and this one surprises people, is doing it with headphones in, listening to music or a podcast. If your auditory attention is already consumed, the cognitive load drops below the threshold needed to produce the adaptation. Walk quietly. Your thoughts are enough company. The Cleveland Clinic's Lou Ruvo Center for Brain Health, one of the leading brain health research centers in the country, has identified consistent mental challenge combined with physical movement as one of the most modifiable risk factors for cognitive decline, meaning it's one of the few things on the list you can actually change right now, today, without a prescription. The word modifiable in medicine is everything. It separates what you're stuck with from what you can do something about. 10 minutes. That's all I'm asking. Not 10 minutes of crosswords at the kitchen table. 10 minutes of walking with your brain working at the same time on something that makes it feel awkward. That awkwardness is the point. That friction is where the growth happens. At the cellular level, through a process called synaptic plasticity, where repeated challenge causes neurons to form stronger, faster connections with each other. Your brain is not a static organ. It was never meant to be treated like one. Margaret still does her morning walk. She told me recently she's moved to the conversation stage. She calls her sister during the walk and they debate things they've read. Her sister, who lives in another state and is 71, started doing it too. Neither of them takes it lightly anymore. What I want you to take from today is this. The brain you have at 70, 75, or 80 is not a finished product. It's still responding to what you ask of it. 10 minutes a day of genuine mental effort layered onto physical movement is not a miracle cure, but it is one of the most well-supported, accessible, no-cost tools available to you. Start tomorrow. Start with counting backwards from 100 by 3s. Feel the awkwardness. Stay with it for 2 weeks. Then progress. I'm Dr. Nathan Wells. Stay aware, stay proactive, and take care of yourself. I'll see you in the next one.